Hi, welcome back to my channel. Ngasi akhoi si video sida eyelid surgery tawra matungda line ani thokpagi matangda yengminasi. Eyelid surgery tawra matungda nauna connection ama piraga akhoi mithuk ama tahalani. Aduga hana mithuk kharpikna yauzaramba mafamda adugi manungda muscle haigadra natraga manungi cartilage gumba ama yauri adugi adudagi skin da laiba connection do break tawdragadi ngasagi mid pang makana ngasagi hanagi laser ama fold ama changjar ama do adugi connection do break tawdragadi adum line ani thokpa se yawi so mithup sunga yawdragadi adu break tawdrasu yai mithup khar yaw boygadi adu break tawba mchangi natragadi ngasagi double line gi problem se lakpa yawi so adumain tawba case ama yiminasi sigi case da hana operation tawgre aduga mithup ani thoe right eye sida adu correct tawnaba amuksu hotnagre hai second operation tawraga still line ani tabagi problem do fix oidre shape ti phajai right side ki je compared to the left side tana inner corner room da fold khar taba wat bagi shape tan phajaba wat le and outer corner room da khar pixel le asi ki je fix tawnaba third surgery tawra matung da sigi photo se yeminasi revision blepharoplasty habatare double lines e fix tawnaba so now sina front view ne before surgery and after surgery see zina right side room degi photo kapagi view before surgery and after surgery next sisna left side room degi kap photo before surgery and after surgery so mayam na su yengbire double line thokpagi problem se after surgery easily fix tawbai tawabu kari maram na thoino and kamaina semdok toino habado fazana understand tawragadi semdok pada easily possible oiba problem ne yam luraba problem impossible oiraba natraga very difficult to correct oiba condition natte double line ki problem se adum easily correctable oi hai tare thank you so much for watching this video matangi video dong thainarase bye